So I'm impressed this many people made it all the way to the 4 o'clock lecture. That's great. Everyone get some coffee in you. So hopefully you guys are in places in your careers where you get the opportunity to give didactics and you're looking for ways to improve them. If so, then you're in the right place. My name is Guy Carmelli. I'm an assistant professor at UMass, which is in Worcester, Massachusetts. We'll take a minute. This is a panel discussion. So I have some canned questions that I wrote out, but it's always more interesting when it's interactive. So I'm going to frequently be pausing to look toward you guys to, ask questions. I think since it's recorded, I'll just be repeating those questions for our audience, for our panelists. But let's start over here. AK, you want to introduce yourself?
I'm Annahieta Kalantari. I am an associate professor and the vice chair of education at Penn State Health, Milton S. Hershey Medical Center.
Hey, I'm Roszczynialski. I'm an assistant program director and assistant professor at Stanford University, and I run the didactic curriculum for our residence department.
Hey everyone, hey, I'm Sreeja Natesan. I'm one of the APDs in the Department of Emergency Medicine at Duke, and excited to be here.
I'm Mike Gottlieb. I'm the Olson Director, Program Director for the Olson Fellowship, Associate Professor of EM at Rush in Chicago, and likewise excited to be here and share pearls and particularly pitfalls I've learned along the way.
All right, so I'm just going to start off with a pretty open-ended question. What makes a bad lecture presentation or slide deck?
So I am simulation like this by training. So I always think about any type of education the way I think about when I design my sims. It's all about that balance between signal and noise, right? So signal your learning goals, your teaching objectives, and then noise in a sim, including you were at Sim Wars earlier today, right? The distracting embedded simulated participant, spurious lab values. And so noise in a slide deck or a lecture is slide overload, more than one slide per minute, distracting colors, too much text, images and animations that don't fit with the content and the narrative that you're trying to deliver. So again, always that balance.
And ultimately, think about it, you're speaking. You're there speaking to people. You're there to watch the person be there. The slides are supplements. If the slides become the purpose of your talk, we're missing the point. Now, there are certain things, I'm an ultrasound person, so of course there's going to be ultrasound things on my slides. But beyond that, it should serve as like a speaking point, as something to highlight. If I want you to know a number, I want you to see a thing, I want you to have an emotive tie to a patient. But you're there to watch me as a speaker. That's why we come and see things in person. That's why you're not going to watch this later. And where we tend to fall off is we get so focused on the language. So one step is making sure that our slides are good. But the other piece is just being there in the moment. Because you know what? That perfectly rehearsed line by line thing that we get down to the exact word, no one knows if we forgot things. Speaker notes are probably our worst enemy because they to be tied in. Mediocre cover.
I'm just talking loudly. So that line by line that we have kind of just ties you in to language that may not fit naturally. You're like, I must say it this way because that's how I've rehearsed it 7,000 times, and no one knows if you forgot a word. No one knows if you paraphrase things. But it does sound really robotic. And it's really boring. And then you lose people.
Our panelists are also my mentors. I will never forget, AK gave me this exact feedback a few years ago because I used to be an actor. So I would memorize lectures like a monologue, and my speaker notes were like word for word, even the dumb joke that I was going to insert. And I ended up falling prey to this being robotic, less flexible. When anything goes out of sorts, then I lose my train of thought, and it really messes with me. And AK gave me this feedback, and since then I've relaxed a bit, and I think my lectures have improved.
I think the main issue is
this one's very light.
I think the main issue is if you want to avoid, death by PowerPoint, don't rely on the PowerPoint, and then there will be no death. And so the part of giving the main thing that we all care about is the story. What's the story? What are you going to tell tell people about. Almost every single talk that I give, there are stories, whether they're personal experiences, whether it's some like made-up old lady that I gave a terrible TBI to in my DOAC talk, like whatever it is, there's a story involved. And I think one of the biggest mistakes in these horrible talks is, as soon as like, oh, I have to give a talk about, let me think of something that I actually think is a real thing. I was going to say hypertension and ED, but let's say lowers chest pain. So let's say I have to give a talk on lowers chest pain. Half the people, more than half the people in this room, the very first thing you're going to do is you'll probably open up to date, and then you open up your slide deck. And that is, I think, the biggest mistake. The best thing to do is go look at all of the data that's out there, what information is out there, and mind map it. Put things together. Figure out what you think is important. That's where you draw out your objectives. And then from there, you can start to develop stories, share an experience, share some things that have happened in the ED, share an interaction that occurred with you and a resident that you were teaching on shift. And it's those stories. Once you get all of that down, then you go into whatever media you use, whether it's PowerPoint, Keynote, don't use Present please, and because I'll get vertigo. And then you start to put things in just to kind of complement the story you want to tell. Don't do the other way around, where you just open up your mouth. You will have death by PowerPoint.
So this is something from one of our learning objectives, and I think it's a good question to ask for people unfamiliar. But can you guys describe Richard Mayer's cognitive theory of multimedia learning?
How would you like it described? So there are 12 main principles that you literally could Google. Mayer's principles of multimedia. And the main parts of these slides, it uses different theories, like Alan Pavio's dual channel theory. You can't hear something and read something at the same time and learn from it. It creates cognitive dissonance. And so literally you just Google these and it tells you what to do. It kind of tells you mistakes to avoid. What are different things that you compare together on a slide and how you can follow these rules in order to allow your slides to visually complement you. They incorporate a few other things. I don't know if you guys want to kind of talk about any of those.
I think one thing I call back to the idea is you're the speaker. If it's robotic sounding, people aren't going to engage. And it goes kind of ties into what guys laid out too, is that if you sit there and I read off a slide like this because this is what I wrote down, it's really not engaging and you get really disengaged. If I'm eyes up, I'm engaged, I'm talking to you, you're seeing me as a person, I'm retaining that. We have an option of reading or listening, for the most part. If I put a bunch of text on there, well, you're going to read it. You ever watch a movie with subtitles? You start reading the subtitles. The words don't match. You now follow the subtitles. And why do I do that? Well, I'm going to send you a paper. I want you to be there, to tie to the story, to get the emotion. You want to listen to the storyteller. That's you. You're the storyteller. We care about what you have to say. If you feel the need that, I need to give you the maximum information, which the lecture is just not the best format for that, then have a handout. That's a great use of a handout. You can even make two versions of it. One's your PowerPoint that's actually just a handout. And the other one's the actual one you're going to use, which is minimal text. Because that's what you want. You want to get the message. You want them to walk home with something they're going to use. And that's what a person with story matters.
And I'll just echo that as well too. I think I like to go to a lot of the talks at SAEM court and just to watch people speak, because I think if you look at the actual 12 steps and all of that, it really is just intrinsic to how we learn, right? And so I like to watch how people make their PowerPoints, how they actually present, because I think much of the message that we're trying to convey is just relating to your audience. And how are you going to connect with that audience? And then you can look around, like someone's nodding their head, thank you, I appreciate that. And that really makes a big difference, right, to connect with your audience and just say, is that message that you're trying to convey coming across? And it's not to say that you shouldn't put things on the slide. Like we're not saying like, we've shifted so much, right? Back in the day, everything was words on the slide. Now it's just like pictures only, which when my students ask me for the slide deck, I'm like, here's a nice like a photograph album for you because there's no words on there. Right? So I'm not sure exactly what you're going to learn from these like pretty pictures I made, but we've shifted from one pendulum to the other, which is really challenging. I do have my notes underneath it for the learners, so that is my like slide deck I give out with the points that they can learn from that. But just it is really challenging that we've swapped from one way to the other. But if you do have words on your slide, just realize you have to give your audience time to read it. Right? Or you can actually make it automated that each bullet point pops up and then you talk about that as a little point, but you have much more information to share about that point. So it's not just all on the slide itself. So it's not to discourage you from putting the words on there. It's just being very thoughtful because you want to be the agent that actually is going to be transmitting that information. And really you want to get everyone's eyes on you, right? This is your moment to shine, so you have a lot of information to share. And so this is a great tool. So you definitely use it as a tool to augment and amplify your work instead.
So, I mean, to summarize some of the points that we've been mentioning, a lot of times getting people to learn is not just about the presentation, but about getting emotional investment in the content, which is what stories are really great for. We also, a lot of studies are showing that you want to use different channels where people take in information. So we have the visual channel, the things they see, the auditory channel, the things they hear. And you want those two channels to not compete with each other, but rather complement each other. And so the all words text doesn't work because you're just going to read. The all pictures also doesn't really work because if the learners are, let's say they miss something that you're saying, they look up at a picture of a lion, that doesn't really mean anything to them. So trying to find that balance, you want to have, images that invoke emotion, but also texts that, spark ideas or graphs that inform what you're talking about. You want it to supplement or enhance what you're saying rather than distract. I'm going to pause here to allow any questions because I want this to be as interactive as possible.
You guys have talked a lot about slide design. Are there situations where maybe you should just forgo slides?
I'm just going to repeat the question for the recording. Is it always necessary to have a slide deck for your didactics, or can you do no slides?
I would definitely say you can definitely go without slides. I mean, this is actually, we know our learners actually learn better in small groups and flipped classroom and all of these things, right? But still, I think if we try to keep the full, how many of your guys use slides at your conference? I was on too, right? When I'm teaching, I also, right? And so this is the kind of strange part is that we know this information, all you guys know this information, and we're all still showing up to the slide presentation, and please don't leave, because we want you to be here. But there's lots of different other options that you can do for small groups and other things.
I think it depends on the objective, right? So whatever you're going to use or not use with your talk or your whatever it is you're trying to teach, it depends on the objective, right? So if it's a knowledge, a skill, or an attitude, like what is the main kind of nugget that you want to deliver, right? So if we're going to teach about central line placement, slides will not help you. Right? Maybe a video, maybe send them a link to a video to watch beforehand, and then they meet you in the Sim Center. Maybe you share a few stories about how you totally, biffed it in your career, putting in this central line and giving them some pointers on what they can do. If you want to change an attitude, right? So I used to work under the L in Philly. And there were a lot of individuals who would come in with alcohol use disorder and different drug addictions and, being exposed to that over and over and over again can desensitize you to kind of the humanism that is behind these conditions. Me doing a PowerPoint on trying to connect with your patients and seeing them for human beings and not like that dude that comes in here drunk all the time, slides aren't going to help with that, right? So you don't really want to use that. If you are trying to address knowledge, slides can be quite helpful. But just as Sree mentioned, you could use other forms of teaching strategies besides slides. You can use small groups. You can use oral board type of, like the foundations that Kristen Grabo, she has another hyphen after her name now, right? More. Like the things that she put together. You know, you could use flipped classrooms. You could use gamification. So it really depends on what your objective is that you're trying to teach that is going to drive the teaching strategy and media platform that you use.
And I would say this is actually my final, if you were gonna take anything home with you, final tip is that, right, your slides should not stand alone, but you should be able to stand alone without your slides. Because how many times technology, especially for me, especially living in Silicon Valley, it's hilarious, but technology just breaks around me all the time. So I think that's just something to really keep in your mind, that your slides do not make the presentation. Like we were all saying, it's you, it's your expertise, it's the knowledge that you're bringing.
So let's pause here on learning objectives, because I think this is a great thing to talk about. It's surprising how often I talk to people, and you know, if I say you have to create a curriculum, they instinctively think we need learning objectives. But sometimes when creating a lecture, they don't necessarily think to make learning objectives. When interestingly, a curriculum is just a planned educational experience, which includes lectures. So we should be making learning objectives for our lectures, rather than what a lot of times people are doing where they just create table of contents, you know, epidemiology, differential management, whatever. And so how do you guys go about creating learning objectives for your talk and then focusing on those during the talk so they don't overload with content?
Honestly, just even after all these years of education, learned this at the resident teaching fellowship with Guy, actually over in August with Dr. Mathieu's talk on lecturing for the learner, right? And it was really interesting because he actually says, make your take-home point slide first. And you're only allowed to have 3 things on there, right? So, which is really important. We all put 20 things on there, right? Which is, because we're trying to jam all that information into our learner's head, right? But he says, make that take-home slide first, and then you're building your lecture, based on that. And he calls it 3 mini lectures. So for each take-home point, you get 15 minutes per lecture of that take-home point, and you're reiterating that information over and over. Of course, he does it in a very engaging way, which I still remember and laugh about. But it really is helpful. And then you pause after each of those take-home points to let them ask questions and really give them kind of a mental break before you jump into the second one. So it was really an interesting new perspective for me to kind of think about what do I want my learner to walk away with, and knowing that, we know with didactics they only leave with 50% and they start losing it after that point, which is really sad. So knowing that, being very thoughtful about what are the 3 pieces I want them to know and how can I give it to them in little bite-sized pieces so that they can actually process it, interact with it, and then walk away with that information and hopefully keep it for a little bit longer than just an hour afterwards.
I think part of it is, well, not part of it, all of it starts with knowing your audience, right? So the talk that you give interns is going to be a lot different than the talk that you give your attendings in a faculty development session on a topic. And so those objectives have to be geared towards your audience. And I think the best way to do that is really through the literature and knowing your audience. Your attendings are going to want to know kind of the late breaking data that's out there, how you compare and contrast that, and then in the end, what is your interpretation of that literature? Your seniors are going to want to know the things that are most likely going to appear on their boards, right? And so kind of gearing things like, hey, this is a heavy hitter on the boards here, know that, and when you go out and practice, these are some tidbits and those are kind of what the seniors want to know. What's on the boards, and when I go practice, what do I need to know? And your interns, they just want to know how to fix K. I mean, it's like the things that you give them, you don't want to get really, really complex because then they're going to have cognitive overload. And so really putting your objectives together is really geared towards your audience. It's not so much what you want them to know, it's really what is important for them to know at the stage that they're at in their career and in their knowledge path.
I mean, that's an excellent point. It reminds me of a story that I learned. You know, we all have these things that we want to teach, but if it's not geared toward our learners, they may not learn it. There was a story of a man who goes to a pet store and he's like looking for a dog, and the pet owner's like, oh, this dog's special, I taught it to talk. So he buys it, and he goes home, and week, month, the dog never talks. He eventually goes back to the pet store and he's like, hey, you said you taught this dog to talk. And he said, I did. He never learned to talk. And so if we want to sit there and talk about our great research and all this other things, but our audience is not interested in that stuff, then it's a waste of my time and it's a waste of their time. So crafting good learning objectives that's specific to your learners is key.
You know, Guy, I appreciate that with your, young little baby at home, that you're working on your dad jokes. That was solid.
Yeah. Let's talk a bit more on the planning phase. I know you had mentioned mind mapping, which I love. So how do you guys approach, you guys are told that you have to give a lecture, a grand rounds lecture at your conference or somewhere else on a topic that you didn't choose in 6 months. What do you start doing today?
So you figure out what your objectives are, right? So that you kind of figured out it earlier. But ultimately, what's your end goal too? Do I want to, is the intention of this talk to teach them everything about a topic, which lectures are very efficient for that? Is it to have a very specifically take-home learn? Is it to evoke emotions? Is it to call to action or do something more? What's the overarching goal? And I'm going to tailor a little bit around that too. If I want to enact change, which is a really good use of a talk, by the way, I'm going to spend a lot more time kind of focusing on that kind of owner talk on the overall tool, and then think my objectives around those, so I can work them a little together.
I'll say to echo AK's point earlier too, when I'm starting a lecture or any sort of talk or teaching, the first thing that I do is, yes, think about that audience and what that needs assessment is, right? What is the gap? Why was I even asked to do this grand rounds? And then as I'm building that narrative, I take pencil and paper and draw it out and draw the concepts and what makes sense to me, even sketching out like images before I even go to a computer to look for images. And I think a lot of us, especially now with these like slide design talks and what have the best slide deck and these really amazing presentations, but it's not about the slides, right? It's about the concept that you're building, that you're trying to impart. And so if you have that and it makes sense for you, then that's a better place for you to be able to share it with any learner.
I'll kind of echo that. I think also just submerging yourself in that information can make you really comfortable, because then you also don't need your slide deck, but you're the expert in that topic itself, because oftentimes we're asked to talk about something that maybe is not, I'm not super passionate about hypertension, but if I'm asked to talk about it, yes, I will do that, right? So maybe I need to think about it, submerge myself in that information, and then think of an innovative way to present it, right? Because I don't like to just stand there and talk to people. I like to interact with the crowd and let them actually kind of take ownership of the learning and be engaged in that information. So I was thinking of ways to be creative with that. And each of us have our own styles of what's going to reach the audience. I could definitely say, things that my colleagues use here, if I try to do it, it's just not going to work with my personality and how I convey myself. And so being thoughtful in that planning stage of like, what is the message you want to convey, being really an expert in that topic is really important, so that it takes away some of that imposter syndrome and that angst and stuff as you're getting there. And then you can kind of think about what story is it that you want to kind of weave through the narrative of that, because that really is what will help the audience walk away with the message that you're trying to convey.
Yeah, I mean, one problem that I always face when creating lectures is I always want to say too much, and I think that's a big struggle that a lot of people face. And the research shows that our audience is only getting about 20 to 25% of what you're learning. So like 1 in 5 of the information. And so actually, if you say more, the audience ends up learning less. Whereas if you figure out the 3 or 4 learning points, and then you do repetition. This is what I'm going to talk about. Talk about that thing, remind them what they're talking about, or engage the audience and really solidify those things, rather than try to cover everything in DK in one lecture. It ends up, our audience walking away with more information. All right, what else can we get from the audience? Any other questions? Yes, and then over here.
So I'm curious about the learning environment as a partnership, because what I'm hearing from you is a lot of things we can do as teachers and as speakers to try to engage an audience. But what about when you encounter that really challenging thing? So I'm thinking residents that have just pulled a lot of hard shifts, they're all sitting there with their laptops out, one's on Facebook, one's watching golf, a couple are chatting. What's the approach to technology and just light that you bring to your classrooms?
Okay, so it'd be nice if we could build our lectures in ways that doesn't happen, but if you are faced with a situation where you are up here and the audience is on their technology and you want to do a meaningful lecture, how would you approach that?
So one, this is just not to be tied to your slides and your pre-scripted talk and be there in the moment. If I look around the room and everyone's eyes are on me, I'm like, okay, cool, it's landing, people are engaged, everyone's looking at me, cool, and I'm seeing the head nods, and people feel good inside, and I'm like, all right, cool, we're in the moment, it's locking. And I start to see people look down, start on their phones, I'm like, okay, this is not landing. I need to be able to adapt. We're emergency medicine, we're really good at adapting to things. So pull out the MacGyver and adapt. You know what, I plan this to be the first 15 minutes of me talking right at you, and 2 minutes in, they're like, nah, that didn't work. I'm gonna ask the first question. I'm gonna, look all level right now. Who here has started giving a talk, and then the learner starts looking down at their phone? That's about 90% of the room right there, re-engaged, right? Now, luckily, everyone's engaged in the first place, but it didn't work, right? Of course, they'll be active doing something, right? Or maybe I'll take a step further. Everyone's a little bit tired. It's 4 o'clock. We haven't had enough coffee in our system. It's all wearing off, and we're looking outside. We're like, it's still sunny. All right, who here has experience blank and have them stand up, right? Do something to activate people. Pull them back into it. Create a cognitive break from just listening and talk. And I'll adapt that. But if you're tied to your slides, you're tied to the exact language of things, you can't do that. You need to give yourself that ability to. One final comment before I pass along is eye contact. So I'm very conscious, like, as you look around, you make eye contact with each individual person, you kind of re-engage them, right? Because it's a lot harder to not pay attention if I'm staring right at you. Sorry, I pulled you on that one. Yes. Right? Like, it happens. It's that you, when you're someone looking, you're like, oh man, I have to really have to pay attention now. But it happens. So you have to re-engage people and be like, oh wow, they're actually talking to me and not just a passing over the audience.
I mean, you bring up a great question, which is the reality. The reality is that all of our attention spans are about at 7 to 10 minutes. And so for pretty much any lecture that lasts longer than that, that's going to happen. And so how do we regather people's attention spans? These are exactly what Mike's saying. I personally like the walk around. You're not going to be on your phone for too much longer if I'm right here. And so I don't like to be tied to the podium too much. I did get feedback that sometimes I walk too much and it's distracting, but getting good eye contact, getting good, engagement is a way I do that. Sri?
Yeah, I was definitely going to say that. I think, just that with your learners, one is setting the expectation at the beginning, right? I always start all my talks saying, like, this is going to be interactive. This is probably the least amount of you we talk during this, right? So they know by the time each time I come to talk to them that, okay, I have to pay attention because Sri likes it to be interactive, so I think that's helpful for just your future talks as well. But even at national talks or any of these things, just say like it's going to be interactive and I need your engagement. And just know you're not going to have the whole audience engaged, right? So that you look at your people, right, who are nodding. Thank you so much. That's great. That makes a big difference to like at least keep your energy up as you're doing that. So just being thoughtful of just finding one person in each side of the room that you can kind of just be like, those are my cheering squad, right? Your cheerleaders that are kind of like helping you keep the energy being conveyed. The second is definitely walking around. Makes a big difference as well. I would say that because we know our learners are very like tech savvy and stuff, the easiest way to turn your audience against you is say like, one of my colleagues says this, is like, everyone's laptops off. If your laptop is up, I'm going to call on you. And you can imagine that everyone, that is the quickest when I see the audience's faces change in my med school classes and stuff too, as I'm watching them teach, I'm like, that is not landing okay. You need to read the room, that is not happening, right? So just, we don't know what our learners are coping with. Maybe this is a coping strategy because they just lost their family member or something, right? We don't know what's going on in their lives. So just being thoughtful, your learners are coming in with their life experiences, but find those people that you can kind of connect with in the audience. But setting the expectations early has really helped me a lot.
And that's what I actually love all these tips that you're giving out. And it works well in this setting, right? We're face-to-face in the era of pandemic and Zoom, and that's not going away. How do you engage that model over that platform?
Great, and I was actually going to follow up. So continuing the conversation of engagement, if you're forced to give a Zoom or online lecture, how do you continue that?
So that's exactly the direction I was going in as well. Love, we still do hybrid lectures at my institution, and so this is a constant issue of our learners engaging. And I think for me, one of the things that I found, certainly gamification is always really helpful. There's a lot of different tools you can use. The annotate function on Zoom is a lot of fun. It can certainly be distracting if you don't have your learners clear for your next slide. Poll everywhere, things that are, I find, a lot of our faculty wanted to try to call out residents one by one to pull them back in. But again, that feels punitive. It's not the partnership that we're looking for. The goal is that hopefully prepared and you're coming in with the intention of really imparting knowledge or change. And if you do that and you're open and honest with them, I'd say actually I use slides a lot less when I do a Zoom presentation, because I find that it is so easy for myself as well to just sit back and absorb the text or images, rather than if it's my face. And the last lecture I gave to us was like, listen, you get 2 slides, and the rest of it's just my face. We're going to look at each other through the screen, and we're going to talk, and we're going to work through something together. So I actually advocate for less slide work in a virtual setting.
Yeah, I would not call people out on Zoom. Listen, I totally peed while on a Zoom call, and if you call my name in the middle of that and I'm not answering, I'm not going to answer mid-pee on a toilet. So I think being respectful of the fact that people are at home, we can ask people to put their cameras on, but sometimes they're off for a reason. I mean, you don't want my camera on if it's a 7 o'clock meeting or 6 o'clock or whatever meeting in my house, because my boys are running around naked behind me, and I'm not going to jail. So I think that you just need to kind of understand that, and calling people out is definitely not the way to go. Using games, using different strategies. I love the annotate on Zoom. I mean, there's different ways to kind of get them, but at the same time, you're not going to get everybody, and it's okay. You don't have to win them all.
I'm just wondering how your strategies change for small versus large group settings, because I think, I have some didactics that are maybe 10 people, right, and then some that are 75. Right? So sometimes I have an easier time with the 75 group getting engagement, because I know to call on, I feel on. You know what I mean? You're in your crowd mode versus 10 people. It's kind of hard to get excited and energized. And I was just wondering what strategies you use for that.
So how do you engage smaller versus larger groups?
It depends what the topic is. So let's say if you're doing something clinical, that is a really great situation to get people to kind of share their experiences. A lot of adult learning occurs in just kind of peer-to-peer shared scenarios. So if you are giving a clinical topic, you could present a case and kind of talk about, here's the evidence that I read about. What do you think? Have any of you been in this situation? And then it turns more into kind of a peer discussion than it is necessarily you trying to lecture to only 10 people. Those are actually some of my favorite scenarios, because everybody really does kind of bring their own experiences in, and I do think that there's better learning in those situations.
Yeah, I completely agree. If I say it's a national talk, show up, this happened to me in January, I was the last talk of the entire conference. Have we all been in that position?
Yeah.
Okay, everyone's catching their flight, no one's coming. And actually it is really exciting, because I just entirely adapted and changed in that moment of, I'm not going to stand up here at a podium let's pull our chairs together, let's sit down and have a shared learning experience together. Yes, I can facilitate the discussion. Certainly I have learning objectives and teaching points that I wanted to bring. But then it gives me an opportunity to learn something as well, which is really, really a rich discussion.
I'll definitely say like having like, even with the environmental like the group is if you can have them like sit with a friend right next to them and talk about an experience, that really makes it really meaningful. They also get to build networks with each other as well too, so I think that's really important. And if you're doing this virtually as well too, breakout rooms is really valuable. I don't think we like realize the power in that. And actually even like for some of my groups that I help to run, when we go to the breakout rooms, like the residents, one is like they'll actually put on their cameras, right? Because they want to see their peers and talk with them. So that's a great way to get them engaged. Then you turn it back off. When they come back to the large group, no problem. You just invite them into the space and say, you know, I would love to see your faces, but I miss all of you guys. Can you put your cameras on? And I understand if you're not going to, but just to answer kind of your question as well, to go back to that. But definitely just letting them have a chance to kind of share their stories as well and their experience with that content, and then adding on and supplementing to that can really help build on the knowledge that they have.
And so some of this is you're kind of even talking about, I prep for all the things that can happen. I check out the room. Is it a big room? Is it a small room? What is the layout of the room? If I'm trying to wander back and forth and the chairs are an obstacle course, that's going to change how I'm going to stand. If I'm tethered to a podium, well, I hate that, but I'm going to be stuck doing that, and I'm prepared for that too. If my slides break down, I have a PDF version that I can use. If there's no slides, no PDFs, there's an issue with the technology, because Silicon Valley has worse technology in Chicago, then I'm prepared to be able to give it kind of, a cappella and just be talking. And if it's a really small group, I'm prepared with, okay, here are my learning points. I now have a little bit of liberty to focus on the learning point, the still overall objectives of this. And how I deliver it, no one knew that it was going to be didactic. I'm just going to talk it through, and we're going to share our experiences. I'm going to help guide that through. I'm going to coach through the discussion. Kind of the Sree's point is like, you're going to hear me talk way less, the fewer number of people in the room, and I'll help guide you through your experiences and try to gather them together to culminate points, which is actually kind of easier to speak for anyways.
So I'm surprised none of you guys mentioned candy as a way to engage people. Question?
So I'm sure you guys have all experienced this where you're in a gigantic ballroom and everyone is sitting in the back or like totally scattered like pepper throughout the big huge room. Like what tactics do you use to get yourself psyched up to interact in that group?
Hi. That's it. Go to them. Hi. How are you guys doing? I'm going to talk to you today about how to get a talk. And you kind of go into that space and control it. That's literally what I do.
You'll see people try to bring 60 people to them instead of bringing one person to that 60 people, and I find that that's really challenging. So instead, it's better for us as the speaker to go to the audience, try to engage with them instead, because asking all of you guys to grab your stuff, move up here, we need to stay on time, then we're trying to give it just not going to work. And also, it doesn't match very well with the audience as well, just as you were thinking, just standing up and being adaptive and moving to the audience. And then if they're all scattered around the room, which often happens as well too, you can wander around, right? And we've had that happen at Cord. And if you're speaking with other facilitators, it's really easy to just like, hey, you're going to take this corner, I'm going to take this corner, and we kind of like split up and you can kind of make it work. So
I actually saw you do something incredible one time. It was a really small room, and there weren't a lot of people in there, and there were a handful of people that were kind of sitting together, and Sree just got up and walked over to them and like sat down and just started talking to them right there. I caught it was at Cord, and it was I came in because I forgot why, and I saw her do that, and I was like, yeah, girl.
I'll say another option too is that engagement that like maybe you've already planned or were hoping to get people to talk to one another, like the think, care, share that Sue was kind of mentioning is if they're scattered, have them come together in smaller groups to network, to talk to each other, to think about a topic that you bring up and then ask for like callback and responses. I have done that at times, and I do think that like, especially if in a scattered situation, if people are grouped back, I love just going to them. And I share that I also was like not a first row sitter in any of my classroom settings. But I do think in the scattered situation, while it is annoying to ask people to move, I think you have that opportunity as a speaker to bring people together and to provide them some content for them to discuss, again, with that idea of really peer-to-peer learning to contribute to your cultural lecture.
And they're more likely to move to each other, to talk with each other, than they are to just move up to you.
It kind of goes back to a little bit more overarching principle that's starting to lay out across here too, which is align with the audience, right? Asking people to get up and move away from their friends and sit somewhere else. That starts you off on the wrong foot, right? Telling people to close your laptops, telling people to do something, that doesn't align, right? You know, it's much better when you go over and you're like, I'm gonna come sit next to you, I'm gonna come stand next to you, I'm aligning with you, then you get buy-in, right? It's much more valuable than trying to force people to meet you where you are, because you already start off in a scenario where people don't feel connected to you. And when you really want to engage with the talk, you want to trust the speaker. And the quickest way to lose that is to disconnect with them.
People really learn in a state of psychological safety. And so all these things that we've talked about, like making them come here, picking on people, all this stuff, they put them in this like flight or fight mode, and they're not really in a good place to learn. And so I think that a lot of how we should be teaching should be geared toward that. A point that I've heard a few times in this regard is if you're asking questions, 90% of us need time to reflect on that question. We need to hear that question. We need to repeat it in our minds. We need to think about scenarios. We need to make sure that that doesn't sound stupid. So what we do a lot of times is we say the question, no one answers within 10 seconds, and we're already moving on or giving the answer and stuff. So to provide that, ability for people to feel comfortable, you really want to increase the pauses and allow them that opportunity. And they might just participate just from the awkwardness of the silence.
I was also going to say, if you need them to report back as well too, like after they're in a group, make sure they know that. Like say, hey, can you choose one person who's going to report back and be the kind of like the secretary, if you will, the reporter of that group itself to convey the notes of that group, so not just their own things, because we need to be thoughtful. We have in the room, I'm an introvert as well, who parades as an extrovert every once in a while and then comes back into my introvert parts, which is here. And so being thoughtful of the different learners that you have is really important. But if you set them up that they know that they're going to have to like share with the group, I think that's really helps them to feel empowered and not be so afraid of the next steps when you say like, hey, we're going to go around, and each of you have to say something. That gets really kind of scary for them.
All right, question?
How do you guys balance when you're giving a lecture like the entire residency, so you have 1s, 2s, 3s, and 4s, who all have different needs and different levels of baseline knowledge? How do you balance your objectives so that everyone is engaged and everyone actually gets something out of the lecture?
Okay, so it's all well and good if you're giving a lecture to one type of learner and you're going to gear it to that specific type of learner. But what I'm hearing as your question is sometimes we have to give lectures where we have a med student, a senior, a junior attending. So how do you create your learning objectives and content for that kind of breadth of learners?
In that situation, right, you're building scaffolding to bring people along with you, because you can't leave your med students and your interns behind, but you also don't want your seniors bored out of their mind for the 4th time they've heard these same things. So it does require a lot more intentionality in the design of your lecture, but you still need to hit all of this. And I do think that this is another opportunity that's really useful for Zoom breakout rooms, in person, smaller groups with mixed levels, so that they can share their experience and those like clinical pearls and honestly from the mess ups that they've made and the misses they've had. And that's usually how I encourage them to start their conversation around whatever clinical topic it is. Because as we all know, our residents, they respect us enough, fine, but they love when their co-residents are talking to them and teaching them, right? Like, it is just such a different experience. I've seen it in our feedback forms of what we hear when it's a resident presenting versus a faculty. Like, they really value that. So take advantage of it.
What do you? Oh, yeah.
Yeah. So the slides with the bullet points, I feel like a lot of the time end up being a crutch for the presenter, right? They're also for the audience, for the presenter, because like they haven't reviewed that whole topic enough to just be able to take the slides down and give a whole lecture. That's like an amazing skill that I think actually very few people have, be like, oh, like take your slides away, present. But so I guess my question is, if it's not you giving a lecture, how do you motivate your faculty to get to that level? It feels like they're busy, they're tired, they had a shift yesterday. How are they going to put in that amount of time that requires so they can just get rid of the slides? It seems like you know a lot of the time, but I don't know if there's a way to motivate them or make it happen. I don't know.
So I guess what we're saying is we know how to give, you know, good lectures, but that's not necessarily our colleagues. So how can we mentor our colleagues who are also giving lectures to the learners to want to do better?
I'll tell you what I've done this last year, and I'm gonna be honest, I have offloaded it to my learners. So now instead of like an attendance checkbox, for every lecture, our residents have to give something they learned from a lecture, and then one piece of feedback to the presenter. And I find that as faculty, like we are so geared towards how effective our teaching is, that actually hearing that feedback from the learners, from the residents that they're teaching, has actually really started to make a difference in the preparation and the delivery that we've seen in the last year of lectures.
How do you get the residents to fill it out?
That's how they get attendance.
Oh, okay.
Yeah, that's how they get their hours.
How do you get residents to meaningful that? Good job.
So they
start using hard score is like the thing I get every single.
So it does take time for me, so I do like essentially qualitative assessment, and that does not count, right? They know how to give feedback. We do lectures on feedback. I do remind them probably every 4 months or so of what qualifies, but this was great, loved it, does not satisfy the requirement.
I think it's also important for you to model that behavior. It's always easy to like say we do this stuff, but to actually do that. And I've found when I give lectures that model this and it shows increased audience participation, it's easier for me to have discussions with these faculty and get them to buy into that. And I've actually been approached by several faculty members who've asked me, can you help me with my slides? Can you help me with my lecture? The challenge is, like, if you're a content expert in, you know, AFib, it's no question people were going to come to you and ask you for AFib content, but it's hard to prove that you're a content expert in lecture, you know, slide design, unless you're just trying to model that and do that and get good feedback, and then maybe you can start to get people on board with like getting some guidance.
Yeah, and honestly, in the end, like it really is up to the speaker how much they want to do this or not, right? And so this is where it gets challenging, because we know our residencies have different requirements for our faculty, right, to give lectures and so on too. And you will sometimes have those few faculty that will share the same slide deck, that will have the same typo on slide 15 that they've had for the last 5 years, which I'm like, can I just have your slide deck and fix that, please? Because I watch it every single year when you make the same joke about it, right? It's not funny anymore, right? So unfortunately that will honestly still happen. I would love to say for ourselves, right, because we can only control, you have to think about the agent of change that you have, the limits of control that you have. And so in knowing that, because all of us want to be, you know, exceptional speakers and reach our audience, is to get away from depending so much on your notes, is just we have to take that leap, right? And I remember my moment of it. I was always behind the podium, always looking at my notes behind there. I was actually in a talk with AK, and this, you know, she and Charlie were both up front talking, and I was at the podium by myself, and I was just like, this will be the first time at this national talk, but I'm going to leave the podium and walk up front and do that. It was terrifying, I admit, and I still remember it. That was probably 5 or 6 years ago. But you take that leap, you know that your notes will not be exactly how you're going to present it, and it's going to be fine, right? Because the audience does not know your notes. And I usually think about it, your audience is the one that wants you to succeed. Right? They're your biggest cheerleader because they came to your session to hear your information. So instead of being afraid, we should all be empowered that we have a cheering squad for us to get this information that can really help you to kind of let go of those slides, let go of that notes that are there, and those bullet points, and just kind of take that leap of faith that you have the content and the information in your brain somewhere, and it will come out the way that you want to convey. And also just breathe. That's the other thing. If you don't know what to say, instead of saying just like pause, it gets everyone's attention back on you, gives you a second to think about what you want to say, and then you can deliver that information.
Yeah, so I agree with all those points, and I think ultimately part of it, no one wants to give a bad talk. Like, no one comes out there saying, like, I want to take this one, right? Your audience does want you to succeed. You know, the worst piece of feedback you give to a learner is read more, the worst piece of feedback to the speaker is read less, right? You're just sitting there reading off the slides, and ultimately, there's a couple options, right? So if people want to give a lecture and they want to get better, it may just have to ask for help. Then maybe that's your opportunity, because experts in this room now, to say, hey, I'm happy to look over slides, give you some feedback, and I'll work on it with you. And maybe they just really don't want to speak, that's not their interest, and maybe it's incumbent on us not to force everyone to speak if they don't want to do that, or at least if they're not ready and it's not what they want to be. And maybe they can find another way to help out. Maybe they could be the ones that can help do some of the research or help in areas that maybe they could be small group instructors, and then someone who wants to speak can speak more. We don't have to have everyone doing the exact same things, and then people just have different ways they want to contribute to the group, and that's okay too.
So to end, I'm just going to have each of our speakers give one final pearl that they think they want everyone to go home with, and we can end there. AK.
I'm making two.
Two pearls,
The one
okay.
thing I will tell you, for the how do you get people to lecture, some people don't want to lecture, and they don't have to. Give them a flipped classroom, give them an oral board, give them a small group. That's fine. Okay, final pearl. I don't think I have anything staged. I'm just going to end on that.
Okay.
I already gave mine, but repetition is the key to learning. So your slides should not stand alone. You should be able to stand alone without your slides.
I think mine is just like the power of a story, right? And that's the best way to re-engage your audience, to help them to connect with the information. They even ask them to share their stories as well too, which helps them to feel empowered and engaged in that information as well too. So just our culture is built on stories, right? And that really is what we carry with us. So definitely think about how to weave that in as you're creating your PowerPoints and your didactics.
No one's going to know what you didn't say except you. Be in the moment, adapt, be comfortable that, you know what, you may miss something you plan to talk about, but truly no one except you will know that, and that's all okay.
On that note, nobody knows what your last slide is. Never go over time. End. They never know what comes after.
Yeah, no, and I guess the thing I'll say is, I really caution about those long, hour-long lectures. I know that we're kind of moving away from that towards shorter lectures because of the attention of our audience. However, if you have to do an hour-long lecture, instead of that, like I mentioned before, slide goes into slide goes into slide, thinking about your learning objectives and maybe breaking it up. I personally like to break up the talk into like 3 talks. So if I want to talk about, differential in one, learning objective, management in another, and admission in another, I just create 3 separate cases. I'm like, in this case, let's talk about the differential, and then you start over. New case, engage the audience, and then tell that learning objective instead of one just run-on thing. I know for me, but I'm pretty sure for all our speakers, we're all happy to either answer questions or to help anyone with their slide decks. You can come ask our emails. I'm sure it's on the app as well. I've always been happy to help people with their lectures, and so I'm sure our speakers. So thank you very much for coming.